and I'm the CEO at Winona Health, and it's my pleasure to welcome all of you to our Benevolence and Blues evening event. I want to just take a quick minute to recognize some of our Winona Health board members who are also here celebrating with us this evening. And if you could just stand for a minute. Ken Mogren. Ken is our board chair. Dr. Brookhammer will be coming. I don't think he's here yet. I know his wife is here, but I think he's on his way. Okay. Fatima Saeed. Fatima's here. There she is right there. Sandra Burke of the fan club Burke.
The fan club Burke.
Greg Evans is up here in front. Dr. Katrina Hamill is right. Yep, stand up, Katrina. Good to see you. Mark Wagner just next to her. And Bob Williams. Where's Bob? Up here in front. Great. Well, thank you all for being here this evening. For 125 years, the stories of the life of the Winona community have been experienced throughout the Winona Health organization. The entire life cycle from birth to end of life and everything in between. Whether it's keeping healthy through prevention and wellness, diagnosis and treatment of chronic conditions, acute emergency events such as heart attacks, strokes, trauma events, surgical interventions, hospitalization for acute care, or caring for our seniors in environments that provide them the support and the care that they need. The Winona Health physicians, clinicians, and staff have delivered on the promise to care for our community, and they do it with care, compassion, and love. Our unique and shared history of 125 years is captured via the pictures in the slideshow that's been going on this evening. So I hope you're taking an opportunity just to watch some of these. There's really some pretty cool slides in there. And then also at the table, our history table over here, that has a lot of pictures and some different artifacts that go back pretty far, which are pretty cool to look at as well. This is the foundation on which we continue to build and thrive at Winona Health. Community hospitals are deeply woven into the fabric of the life of the community, but not all of them are like Winona Health. From our founding, the entrepreneurial and innovative spirit of the Winona community has continued to flourish at Winona Health and is what will serve us well for the next 125 years. So I wanted to read a few statements from a document that was actually over on that table. It's called the Cornerstone Book. This book was put together when the current hospital was built. That hospital, by the way, is as old as me. And so there's some pretty cool documents in here, but there's a letter at the end that this had to do with the Cornerstone ceremony that was held on November 3rd in 1961. And so I just wanted to read a couple statements. This is more than a ceremonial procedure. The setting of this cornerstone today represents the last physical act necessary to complete the exterior construction of this institution of mercy and monument to the will and determination of a community and its people. With the laying of this cornerstone, we will preserve for posterity the lifelong history of our hospital, beginning back in 1894. The history of the development of this particular project, together with the records of the men and women whose dreams, perseverance, and labor made all of this possible. After this construction has outlived its usefulness and this box is opened by some future generation, the modern developments, some of them appearing for the first time in an institution of this nature and size, that we now look forward to by using with pride and hope, will be outmoded and might even appear to be exceedingly primitive to that generation. And I think this sort of speaks to the constant evolution that this organization has gone through over 125 years. We have visionary leaders across through our board, throughout the organizations and our medical staff that see what's possible and where our organization needs to go. And we build on what has been before us. And we had great visionaries that were before us. So what I'd like to do right now, before we do our program later this evening, and I think that will show you some of the things that are demonstrated by these comments here. But given our history of 125 years of serving the community, it is my pleasure tonight to invite a special guest, Mayor Mark Peterson, who recently retired from the Historical Society. I think that's really apropos for a 125-year organization. We got a twofer for that. To come to the stage and share a special announcement with everybody. Mayor Peterson.
Just for the record, I haven't retired completely yet. I announced my retirement, and it's not until May 17th. Some people might want to get rid of me sooner, but that's okay. And I'm about 10 years older than the hospital. But good evening and congratulations to Winona Health on your 125th anniversary. It's a remarkable achievement. Also, a special thanks to the people who work at Winona Health and to all those who are receiving special recognition tonight. All are very well deserved. Yesterday, I had the need for the services of Winona Health. I'd like to take just a moment to share this experience. I called my primary care physician's office because I've been having an issue for several days. He wasn't available, but they made an appointment for me that afternoon with, I guess I can share it, Dr. Ferris. The doctor came in after reading my chart, I'm sure, and sat down and said, "I know what your problem is." Believe me, after searching Dr. Google the last few days and seeing what all the possibilities were, I was pleased to hear the doctor's comments and confidence. He did the exam and decided he was right. A couple of nurses had to follow up with another test, which required me to leave my dignity at the door. What I remember most was the nurse who took just a few seconds to rub my foot when it was all over, as if to say, "It's all over and you'll be okay." That small gesture really meant a lot. And now, on behalf of all the citizens of Winona, I'd like to read a proclamation. Whereas 125 years ago, local physicians and concerned citizens met on February 24th, 1894 to discuss the need for a hospital. And whereas they agreed there was a pressing need, and although the challenge of starting a hospital was daunting, on February 28th, 1894, the Winona General Hospital Association was established. And whereas over the next 125 years, the organization's name and location would change, the ongoing generosity and commitment of community members helped shape what is now Winona Health and demonstrated that it is a community asset worth supporting. And whereas Winona Health is deeply rooted in this community and continuously and proactively evolves to meet the community's healthcare needs. And whereas for 125 years, Winona Health's mission to improve the health and well-being of the greater Winona community has remained steadfast. And whereas Winona would not be the same without this innovative and independent community-owned healthcare organization. Now, therefore, I, Mark Peterson, Mayor of the City of Winona, do hereby proclaim February 28th, 2019 as Winona Health Day in the City of Winona, and encourage all citizens to join Winona Health in celebrating 125 years of community-focused healthcare. Congratulations.
Thank you, Mayor Peterson. Tonight, we're all blessed to be in the company of our wonderful family, friends, and neighbors. So let's enjoy our dinner and conversations, and then when we get to dessert, we will start our program. Enjoy the evening.